Good afternoon. Thank you for joining us. It is official. The Vancouver Whitecaps have signed German soccer legend Thomas Müller. We will talk about that up first. On the open line, more emergency room closures in Oliver, 100 Mile House, and Delta. We're asking you, what is going on at BC's emergency rooms? We'll take your calls. And former Vancouver Canuck goalie Kirk McLean and his wife Genevieve will join us to share how cancer has affected their family and all to promote cancer research and treatment. They'll be here at 12:45. I'm Michelle Elliott. Welcome to BC Today. Thanks for joining us here on CBC Radio. That's CBC Television as well, and live streaming on YouTube, CBC Gem, and on our TikTok Live. Thanks for joining us. Up first, the Vancouver Whitecaps have officially signed German football star Thomas Müller to a contract. Rumors had been swirling around the soccer world for weeks that Mueller would be joining Vancouver for the remainder of the season, and his contract with his German club, Bayern Munich, expired last month. For more on the significance of this signing, we've reached Rob Williams, the national sports editor for Daily Hive. Hi, Rob. Thanks for being with us.
Hi, Michelle. How are you?
I am fine. I heard the buzz all through last week. The buzz was buzzing. Tell us how significant this is. Why is it such a big deal?
Yeah, it's massive. Buzz is a great word for it, and I think it's something that the Vancouver Whitecaps are hoping to accomplish here. This is one of one of the global stars in soccer. To give you an idea, like just how big he is, like he has nearly 15 million followers on Instagram. That's more than every Vancouver Canucks player put together. They don't come close to the global following that Thomas Müller has, and this is the first time in Whitecaps history that they've landed a true big name player coming to them from Bayern Munich, one of the biggest clubs in the world. Now, he is 35 years old. He's not the player he once was, but he still promises to be an exceptional player at the MLS level and someone that can help the Whitecaps win and sell tickets.
Yeah, and how much is this costing the Whitecaps?
It's costing quite a bit. They've got him on a multi-million-dollar deal, reported multi-million-dollar deal for next year to become a designated player, and he's on a shorter contract, a smaller deal for the remainder of the 2025 season. But yeah, this is like he's by far the highest paid player in Whitecaps history. He is by far the most notable player in Whitecaps history. They also had to pay $400,000 just to gain his rights from another club, from FC Cincinnati. So the Whitecaps are definitely spending more on this player than they ever have before. More than double any player that they've ever spent on before.
So what are they hoping for here? As you mentioned, he's kind of heading into the twilight of his professional soccer career, but what do you think the Whitecaps are hoping to gain?
I mean, I think this is a really pivotal time in the history of the Vancouver Whitecaps. The team's for sale. They are looking to build a new soccer-specific stadium, perhaps at the PNE. I think getting a bit of buzz, getting a bit of notoriety with this signing promises to help, right? It promises to get the attention of a prospective buyer, promises to build up the excitement within the market. Maybe it helps, helps with the local politicians on reducing red tape to get a stadium built. I think all of those things are important, but the best way to make all of those things happen is to win. They're currently enjoying the best season they've ever had since entering MLS in 2011. They've got a real chance to win their first ever MLS Cup this year. Mueller's an attacking midfielder player. He should be able to help within their system and perhaps be a difference maker. Certainly, he's going to come in with a ton of swagger and come with a ton of respect for from all the other players on the Whitecaps.
Yeah, and how long do you think he could wear the Whitecaps jersey?
Yeah, it sounds like it's a 2-year deal. They refer to it as an option to become a designated player for them in 2026. I think that from all the reporting that has been done, it sounds like it'll be the remainder of this season and next year. Hey, if it goes really well for them, maybe beyond. But he is 35 years old. He's going to be 36 later this year. So yeah, I think we'll be asking a lot to ask him to play into his, age 38, 39, 40. But maybe we can, maybe the city will knock his socks off. He was talking it up. He was talking it up quite a bit today in a German language interview. He said he spoke to Alphonso Davies, who is, of course, played for the Whitecaps and stars for Canada internationally, and they were teammates at Bayern Munich. So that was one person he spoke to about the city. So the reviews must have been glowing to sign in Vancouver.
Yeah, and hey, maybe more Instagram followers. Not that he needs it.
I followed him recently, so there you go. Get the bump.
It is certainly gaining a lot of buzz here, as you mentioned, and a lot of excitement among fans. Rob, thanks so much for joining us.
Anytime. Thank you.
That's Rob Williams, national sports editor for the Daily Hive. It's 12:12 now. You're with BC Today. And coming up, we are going to take your calls on healthcare in BC. Amid more ER closures, we'll ask you what is going on in emergency rooms in British Columbia. We'll speak with the Rural Health Network, as well as an ER doctor as well, who practices in another province but knows this issue well. Healthcare, of course, one of the issues raised by people who responded to the BC Business Council when it asked people why they would consider leaving the province. We spoke with the CEO yesterday, and we got these emails as well. John writes, reasons required to stay in BC. Create more jobs, especially in the resource areas, mining, logging, fishing. 2, build another pipeline to get Canadian oil to a port in the Pacific Ocean. 3, start building homes immediately. Use government employees to help the journeyman carpenters kickstart building homes. Use military, RCMP. These positions rarely contribute to the economy or country during peacetime. 4, eliminate carbon taxes and triple the number of doctors in the province. Thanks for your email there. Marjorie writes, not having a doctor, the high cost of living, including housing, and frustration that BC continues to base its economy on primary resources. Quebec produces beautifully crafted furniture, not just crafts people producing them, it's actually companies. So why can't BC do something with its resources other than export them to other countries? Whether on the southern mainland and island, the only reasons I don't pick up my steaks. Thanks so much for your emails. bctoday@cbc.ca is where you can send us your thoughts. (12:14) now. You're with BC Today. Well, in Delta, the mayor is demanding answers about the overnight emergency room closure last Monday. Fraser Health says this was due to a physician falling ill unexpectedly, and it called the closure a last resort. This was the 3rd closure this year at the Delta Hospital. And last February, the city's mayor and council wrote to the province urging more support. Mayor George Harvey says the community is being shortchanged by Fraser Health.
We're continuously being underserved by Fraser Health Authority. We already have the highest wait times for ambulances to come to emergency calls at people's homes or businesses. We already have absent urgent and primary care centers, where everywhere else, every other city, every other member the Fraser Health Authority has. So this has just compounded my concern, the council's concerns, and the community's concerns about we are not getting our fair share of funding for our Delta Hospital. We do not have any urgent and primary care centers in our city. Other cities do have access to that, we don't. And that's one of the reasons that our emergency department is overtaxed so many hours. People have nowhere else to go. Many people do not have family doctors. Their only recourse, of course, is to come here to the emergency department. when one person who becomes ill shuts down an organization, an emergency department, how fragile is that system for all of the province? And I'm speaking now as a mayor for Delta, but I'm also supporting the mayors in other cities in the province that have their emergency department shut down, not just for a 12-hour period, but for over a week. So is this where we are at for healthcare to us who pay and support through taxes the healthcare system in BC?
That is Delta Mayor George Harvey. A Fraser Health spokesperson said in a statement, quote, in collaboration with the Ministry of Health, Fraser Health is working actively to stabilize emergency services by addressing staff shortages, filling vacant shifts, and strengthening physician recruitment efforts, end quote. Now, BC Today did request an interview with Health Minister Josie Osborne. She is away. But also this week in Oliver, the ER at the South Okanagan General Hospital closed on Monday. It reopened yesterday at noon, and the 100 Mile District General Hospital closed Sunday night and most of Monday. Okay, so this is in the wake of many hundreds of closures in BC's ERs over the last year. So we're asking you, what is going on in BC's emergency rooms? How is this crisis affecting you? You can call us by hitting pound 690 on your cell phone or dial 604-669-3733, 1-800-825-5950, or email bctoday@cbc.ca. You can also leave a comment on our TikTok Live. My first guest is Paul Adams, the Executive Director of the BC Rural Health Network. Good afternoon. Thanks for being with us.
Good afternoon, Michelle.
This has been ongoing for years now. Has this become kind of a normal occurrence for people you work with, especially in rural BC?
It's definitely become a frequent occurrence. We've had closures just over the last couple of weeks in all regions of the province, from Port Hardy on the island up into the north throughout the interior. And these closures will likely continue for the foreseeable future because we keep trying to manage the problem with the same tools.
Paul, why do you think this problem persists?
Well, we know that we have a global shortage of healthcare workers. We've been underinvested in the province over the past 25 years in putting in training facilities and recruitment programs. We've stepped up in that regard, and the current government and the minister and the premier have made significant advances in the new medical school and in attracting medical professionals from overseas and other jurisdictions. But we have a huge attrition rate. We have an aging population, not just within the general population, but within the healthcare system itself. And we have a drop-off because of the overburdened system. So we have people leaving at a higher rate than, or at least at the equivalent rate that we can recruit them. So we don't see that gap is going to close in the near term. So I think we really have to start thinking about alternative means and methods of keeping our emergency rooms open.
Right, because putting it that way, that it's also about attrition and an aging workforce. How far can recruitment really get you? So what are the solutions that you're thinking of?
As an organization, we really work with community, and we listen to people from all over the province. And so, we tend to have an old model of care, which we're dragging forward into the 21st century, and the problems that we see in the emergency room are compounded from what's happening in primary care. So we hear a lot, and we just heard from the mayor of Delta that people are lining up for their primary care needs within emergency departments, and that happens in rural and remote across the province as well. So the primary care situation really is a burden upon the emergency room. You've got an overstrained workforce. So you need to start thinking about how we can expand primary care beyond a physician or beyond a nurse practitioner and look at how we can extend the scope of practice of people so that we can provide more provisions within community and start looking at health and wellness and not just illness and the cure to the problems that people face. The old adage that an ounce of prevention is worth a pound of cure really does have a truth to it, and we need to really start looking at the health of the population. we need to start managing conditions outside of the emergency room, and we need to put more boots on the ground.
Paul Adams is my guest, Executive Director of the BC Rural Health Network. And in light of more emergency room closures this week, Delta has been making headlines as well. In Oliver and at 100 Mile District, closures there earlier this week. In light of that, what is going on in BC's emergency rooms? We're asking you that question on our open line. And has the ongoing issue of ER closures affected you? You can call us up, but just hit pound 690 on your cell phone or dial 604-669-3733. And you can also email us, bctoday@cbc.ca, or comment on our TikTok live. And Faring Lau comments, nationwide, our healthcare system is very backwards and slow. Thanks for that. We're going to hear from a doctor actually in New Brunswick facing similar issues in about 10 minutes from now. Thank you for your comment. Kayenta writes, will bringing U.S. healthcare workers to rural BC help relieve some of this? Seems like it would. Paul, why don't I put that to you? As you mentioned, there have been efforts to bring in, to recruit from south of the border as well as other provinces. How we talked about the need for to relieve the pressure in the first place, but is that going to help at least in the short term, all this recruitment?
Everything helps. You know, it's not that we're doing the recruitment side of things badly. It's that there's literally not enough people to recruit into the system. So there's the same shortages happening south of the border. It's not a problem just to, it's a global problem.
Yeah.
So we see this happening everywhere. And if we're successful in recruiting out of another jurisdiction, because we're providing a more attractive workplace, and that's fantastic. But it's not going to, solve the global problem that we face as a community. So we really need to look at how we can change systems and modify approaches. And those things are happening. I mean, we're seeing technology come in amazing ways within the healthcare field. But there is a time here where there is a gap which is going to be created, and we need to bridge that gap in the short term. So looking at more emergency measures, and as you stated, it's a national problem. We have some significant spending being promoted by the Prime Minister in regards to military expenditure. Perhaps we should be putting significant efforts into putting, emergency response from a medical perspective within those spendings for military pieces. We need to look at how we can extend our paramedics and bringing education into our high schools in rural and remote communities that involve health and health training, and then recruiting from within and filling the bottom ranks, and then recruiting upwards.
I'm just going to jump in here, Paul, and take some calls from our audience here. Mehdi is on the line in Victoria now. Hi, Mehdi. What are your thoughts on what's going on in BC's ERs?
Good afternoon. I have two issues to talk about. One is that the amount of money that we are spending on the management of the healthcare system is way over whack. Is around 30% of the budget is being spent on the management. It should be 5 to 6% at most. That's one thing. The second thing is that this is a prelude to privatization. They are going to create a crisis intentionally. In 2009, when the government wanted to hire department heads, one of the conditions for the applicant was the ability to create crisis to force change. So they are creating a crisis to force the change that they want, and that is privatization.
Where is that coming? Okay, and that, I mean, where did you see that there was actually a condition of employment?
Yes, believe me, I can. If you Google it, that conditions are taken out. But there is an article about BC civil liberty that talk about it and criticize it at that time. Okay. So this is what they are doing. They are trying to make us so fed up with the system that we accept privatization. Thank you.
Thank you so much for the call, Mehdi. So the concern there about looking toward privatization to fill the gap. Mac is our next caller at Ladysmith now. Hi, Mac. Have you been affected by these ER closures?
Definitely I have. Several years ago, 3-4 years ago, the Chemainus healthcare center, which operated as our emergency room, and I used several times under various things, and my family, was shut down intermittently and for long periods of time because of lack of doctors. The Island Health executive decided they would hold a community meeting. The executive came to Chemainus, held a nice meeting, and heard from people. All the people said, well, the obvious is get some doctors and keep it running. We need it. What happened instead? Island Health executive said, let's do a survey over 3 years to determine what the real needs are. I'm sorry. That was the most pitiful answer under the sun. Had I been in charge, I probably would have fired them all on the spot.
How frustrating was that for you to hear that?
Given the shortage of doctors, what should have happened is those executives should have begun taking periods of time in the OR, in the emergency room, and kept it going. And that would be a very good short-term solution while we go out and do everything else of hiring doctors, training doctors, and whatever we have to do. But at least these executives won't be sitting in fancy offices, pulling down incredibly high salaries, and essentially not helping the problem. Help alleviate the problem and give people comfort.
Yeah, Mac.
That's my idea.
Thank you.
Get them out of their offices and get them working.
Into the ER. Mac, thank you so much for that. Jen is in Nanaimo now. Hi, Jen. What are your thoughts on emergency room shortages and intermittent closures?
Hi. Yeah, I have a bit of a different angle coming from that. I'm a nurse, I graduated last year from nursing school, and there's quite a few of us in the same situation. Like, it's, great that they're saying that they're going to get doctors and nurses from out of country and try to fill this the need. Except I've been shortlisted for one position since I finished school, and I've applied for over 38 with the Island Health, all the way up from Victoria up to Campbell River, and I just keep getting the generic email that they've gone with a more qualified candidate, which I have excellent references. My preceptor, my instructors, I have experience, and they're not even giving me an interview. I've had one interview, and then they just didn't call me back. Said they call my references and just never called me back.
Wow.
And then when I was doing my preceptorship in clinical, which, mind you, we have to work for 4 months full time with zero pay as a student in the hospitals, I, as a student, would have 7 patients at times when we're only supposed to have 4. So there's such a need for it, yet they're not even hiring us. And I'm not the only one. There's so many of us on the island, and the nurses, even for BCCNM, had a rally on the island a few months ago. They have it everywhere, saying that they're tired of being overworked, having twice as many patients as they're supposed to, yet they're not. I don't know who they're hiring, but it's not any of their local nurses.
Oh. Jen, thank you. Yeah, I can imagine that's frustrating to hear when you are looking for work. Thank you very much for your call in Nanaimo. Paul, I noticed we're hearing from several callers on the island there, right? So these, as you said, this is happening in every region of the province. And with 100 Mile, when the hospital ER was closed earlier this week, patients were asked to go over to Williams Lake. So what is the impact, especially on patients in rural BC?
Well, we got huge distances, right? So the distance between hospitals is not like Delta to half an hour to the next facility. It can be hours, and so the patient's life is further at risk. The comments made about administration, I'm not sure they accurately reflect what happens in the system. I think we have about 12%. Going to admin within the BC Health system, not 30. And that, again, we can probably cut costs there, but it's not going to amount to a significant amount. The real need is to think outside of our existing box of providing increasing bonuses to people to live in a community and make our system more attractive to work in. And that means that we have to really look at the entry point, which is primary care, and making sure that through the primary care review that we're attaching people to places of care. and giving them continuum of care
Yeah.
and longitudinal supports. And these things are really critical to taking the weight off the emergency room.
Really good to hear from you today. Thank you so much for joining us.
Well, thank you.
Paul Adams is Executive Director of the BC Rural Health Network. And we're going to go back to more of your calls. And after 12:30, we'll also speak with an ER physician for more on this story. Right now it is 12:31, time for a CBC News Update with Rob Zimmerman.
Good afternoon. A First Nation has lost its request for a court injunction to stop a 4-meter addition to the tailings dam for the Mount Holly mine. The Hatsuth Nation went to BC Supreme Court in April, saying the decision was approved without proper consultation and the work was allowed without an environmental assessment. However, Justice Michael Tamman ruled consultation was deep and said the nation was given ample opportunities to give its perspective. Police say a fire in Port Alberni Friday that left a man dead and a woman in serious condition appears to have been intentionally set. Investigators are looking for security or dash cam footage. Names of the victims have not been released. And German soccer legend Thomas Müller says he is coming to Vancouver to win a championship. After a week of rumors, the Whitecaps confirmed today Mueller signed with the team and is expected to arrive next week. He's considered one of the best players of his generation and was a star with Bayern Munich and helped Germany win the World Cup in 2014. And now the forecast on the north coast, mainly cloudy this afternoon with a high of 16. Highs up to 20 with showers and a risk of thunderstorms in the Peace and central interior. Highs around 19 with local smoke showers and a risk of thunderstorms in the Kootenays. In the southern interior, including Kelowna, you may also see some showers and thunderstorms this afternoon with a high of 22. And for Metro Vancouver, Greater Victoria, and the Fraser Valley, cloudy today, a slight chance of showers with highs around 20 degrees. That's your CBC News Update from Vancouver.
Rob, thanks so much. That's Rob Zimmerman in the CBC Vancouver newsroom. Yes, quite a bit of rain. A relief, a respite. I'm sure many people feel the same. Thanks so much, Rob. That's Rob Zimmerman in the CBC Vancouver newsroom. This is BC Today here on CBC. I'm Michelle Elliott. Thanks for being with us. We are continuing our discussion about what is being called a crisis in BC's emergency rooms. This follows a third temporary closure at Delta Hospital. ERs in Oliver and 100 Mile District also saw closures this week. So we've been asking you, what is going on in BC's emergency rooms? And how is the crisis affecting you? Our numbers again, pound 690 on your cell phone or 1-800-825-5950, 604-669-3733. We're getting lots of comments on TikTok and our emails as well. Corey writes on TikTok, we can run billions in debt and can't fix our emergency room issues. That's sad. And Roman writes, I don't think we can solely blame the government. The fact of the matter is that it's not only about putting bodies in to fill positions. When are we going to admit that people don't like to work in the healthcare industry? That's why there's a shortage of workers, aside from many other reasons, like being an expensive city to live in. That's Roman in North Vancouver. And Dawn writes from Summerland as well, what is the purpose for urgent care? I tried 2 urgent care facilities in 2 different cities. Neither had doctors until days later. They're a great alternative to going to emerge, but are useless if there is no doctor. Dawn, thank you for the email from Summerland. For more on this now, we are joined by another an emergency room doctor in another part of the country, because this is an issue affecting all provinces in Canada. And Dr. Fraser Mackay is an ER physician in St. John's, New Brunswick. He's a member of the Canadian Association of Emergency Physicians. Thank you so much for joining us. Good to have you with us.
Great to be here.
I know that you're on shift and you're actually stepping away from your shift to do this interview. And I really appreciate it, because I'm sure you are incredibly busy. I mean, what are you seeing in your emergency room?
We're seeing this across the country. Now, to be clear, there is another physician on site covering for me right now. So I haven't walked away from my responsibilities.
Good.
I'm just lucky that we've got overlap for another hour.
We are fortunate. Yes, thank you.
We are seeing across the country, in emerges big and small, rural and remote and urban, a whole combination of challenges with increasing workload, complexity, numbers, volumes, at the same time that we have a huge gap in our workforce. And so the combination of this has led to this situation, which we've seen coming for a long time.
As a physician yourself, how does this affect you?
It impacts our decisions on how much to work, on how long to work, and that extrapolates out to the longer term. How many years can you keep doing it? But just in terms of, there is a constant deluge of requests to pick up shifts, and not just, I work in 3 different sites in my home base. I try and locum on occasion in other places, and every morning I have requests from across the country, from all the different provinces, saying, can you take any number of shifts in our emerge and our emerge and our emerge? And that's constant. And much as I would love to help, I can't usually ever leave where I am, or then the shifts that go unfilled here. And that problem is universal in Canada.
Did you say from across the country?
Absolutely. So in the Atlantic provinces, we're fortunate to have what's called the Atlantic license. So you can work in any of the 4 Atlantic provinces without any real challenges. But I've done locuming in the Northwest Territories, and I've had offers in Ontario, British Columbia, and the Prairie provinces as well. And because of my advocacy work with the Canadian Association, I stay in contact with all these organizations so that I'm aware of what's going on. And yeah, the request for locums is never ending.
We were talking with the BC Rural Health Network a little while ago, and he said, you can keep recruiting, but as we've been talking about, this is a nationwide, indeed a global issue. So you can only recruit so much because you're taking from the supply in another jurisdiction. So what do you see as a solution?
It's really, really complicated. And so it's interesting listening to the comments you're getting on social media. The frustration, the anger, the sort of hopelessness that the public has, and some people in the business have as well. And that's because it's such a huge and complex beast that if you try and attack one particular problem without taking it at a systems level, you're pretty much guaranteed to fail. And so the main issue I think we're looking at today is human health resources, absolute number of physicians. Now, our association predicted in 2013 or 2016 was our last statement, that we said by 2025, we're going to be minimum 1,500 emergency physicians short in the country. I think we were probably shy of that mark, but we were certainly accurate in the prediction. And so this has not been a surprise. We've seen this deficit coming for a long time. And now things are so bad that there is, I think, a perception that people don't want to do our job. And that's not the case at all. It is a great job. It is an honor and a privilege to be an emergency physician. But yeah, it's really, really hard. And the workload has increased so much that a full-time job now usually entails fewer hours than it used to, because the job is so mentally and physically exhausting that in the old days, 16 or 18 shifts in a month was common. Now it's getting very, very rare because that pace at work is really not sustainable for a lot of people.
So what do you see as a systemic solution?
The systemic solution has to be, first of all, it has to come from the highest levels, not just provincial leadership, but federal as well. But recognizing that healthcare is provincially organized, we have to have senior leadership at the same table with health authorities, but also with the bigger picture, the colleges, the medical schools, the nursing schools, the paramedic academies. The human health resources planning has to be integrated, and it's got to be done in conjunction with designing the rest of the system. And that's a challenge. You can't look at primary care today,
Right.
emergency medicine tomorrow, and nursing the day after that, because everyone's working in their own little world, protecting their own piece of the pie with finite resources. But if there isn't an integrated plan, how can we expect it to work long term? And so my organization, Canadian Association of Emergency Physicians, created a massive but very impressive document called EMpower, which is emergency medicine. So it stands for Patient Care, Organizational, Workforce, and Ecosystem Redesign. And it is a it's a 300-page document, but it's broken down into some very simple subheadings. And it is a template for an approach to addressing all these challenges. And the whole point is it has to be done. You have to have your accountability design along with your emergency medicine networks design, along with your human health resources planning. They all have to be done together. And so that's a huge undertaking. So that takes all parties coming together.
Yeah.
So that takes a lot of political will. It takes a lot it's a bit of a leap of faith because people have to engage in a process now to try and fix a problem 5 and 10 and 15 years down the road. And so it's an opportunity for leadership now to be the saviors of our children, so to speak, so that 10 years from now, you're not having all these closures. But if we don't start now, it's only going to get worse. Dr.
Mackay, I'm glad that, yes, you do have another physician working with you there, but I do appreciate your stepping into this interview now and giving us your thoughts. Really good to speak with you. Thank you.
My pleasure.
Dr. Fraser Mackay is an ER physician in St. John's, New Brunswick. He's a member of the Canadian Association of Emergency Physicians. Let's take some more calls now. In fact, Anne-Marie is joining us from Rossland, who is an ER doc. Hi, Anne-Marie.
Hi there. Can you hear me okay?
Sure can. Yeah. What are your thoughts on these ER closures then?
Well, I am a permanent locum physician, so I go to places like Williams Lake and Terrace and Nakusp and New Denver and wherever I'm needed. But as Fraser said, at one point we can't be everywhere at once, which brings a bit of moral distress. I know, and I probably can speak to, I think I would speak for several physicians in saying that it's one of the barriers to our mobility is certainly privileging and credentialing within each health authority. So, of course, in BC, we have more than one health authority. That is a big barrier to movement, I would say, for a lot of people because it's a considerable amount of time to do all this paperwork. And so, to have essentially mobility within all health authorities without redoing the same paperwork would be an ideal small goal to work toward, I think, within the province. And then secondly, as Dr. Mackay was talking about, the Canadian Association of Emergency Physicians and the Canadian College of Family Practitioners, et cetera, have been working for years toward advocating for a pan-Canadian license.
Right.
Ontario and the Atlantic provinces are allowing incoming physicians with licenses from other provinces to come in and practice, which has certainly broken down some of the barriers to mobility nationally. I mean, I'm, of course, concerned about people in BC, especially rural parts of the country, but I'm also trying to look at my utility as a Canadian nationally. Yeah. I have worked up in the Northwest Territories as well. So those are two small, not very sexy or exciting solutions, but yeah, those are always on my mind.
Very thoughtful. And I mean, that's something that Dr. Mackay talked about as well, that ability for him to work or take shifts in other Atlantic provinces. I've heard that come up before. So it'll be interesting to see how much traction that gains, that pan-Canadian license. Anne-Marie, thank you very much for the call. Really appreciate it.
Thank you for your time.
Yeah, take care. Jillian is next in Port Alberni. Hi, Jillian.
Hello. Your guests have talked about the absolute number of doctors and thinking outside the box. It takes 10 years to form a doctor. We have to look after ourselves in the meantime. And the people that are being left out of this equation are we the people. The education system is not teaching us health and guidance. The Yukon had a program back in the 60s and 70s, grade 5 to grade 11, once a week. It covered all aspects of human health, and it created a mindset. Right. Now we're in a situation where it's all little fiefdoms, but in the COVID pandemic, World Health Organization set up something that can be a model. It's called Open Who, and it involves modules of health, and it would need to be done under Health Canada or a provincial jurisdiction so that it's authenticated, valid information. It would involve self-teaching voluntarily to skip over all of the little fiefdom divisions. And I would suggest that the first modules that need to be set up are for adults, but going down through the school system. And you would cover human anatomy, childhood diseases, nutrition, fitness, cardiology, just break it down in little modules. But OpenWho is a great platform. You can get little certificates that students could use for credit in school if their schools adopted it.
Okay. Jillian, thank you very much. That's OpenWho. That's a World Health Organization. And again, going back to what our previous guest said in terms of the focus on primary care, and looking at the continuum of care to ease that load on emergency rooms. Thanks so much for all of your calls. It is now 12:46 and you're with BC Today. Let's go to Zoe in Victoria now as our final caller on this. What are your thoughts on ER closure, Zoe? Hi. Oh, I think we lost our connection with Zoe. My apologies. That was Zoe in Victoria. We've lost our connection with her. I will try to give her a call, perhaps for a future segment on ERs. Right now, let's take you to what's going on the coast this afternoon with Gloria Makarenko.
Hello there, Michelle. It's Gloria Makarenko here, and I really hope you can join us for On the Coast later this afternoon. We're going to be talking about a number of lawsuits against large tech companies, including Meta, which owns Facebook, that have been filed in BC Supreme Court, alleging that those companies are using thousands and thousands of books to train its artificial intelligence without the permission of the authors. So we are going to hear from the representative plaintiff in these cases. Local journalist and author J.B. McKinnon is going to be our guest this afternoon. Also, she is a pioneer in Vancouver contemporary art, and now sculptor and designer Martha Sturdy is also one of this year's appointees to the Order of BC. Martha Sturdy is going to join us here in studio on the Coast this afternoon. I hope you'll tune in between 3 and 6.
It is 12:48. You're with BC Today. Well, former Vancouver Canuck goaltender Kirk McLean and his wife Genevieve are sharing their stories about how cancer has affected their lives. Genevieve is a 3-time cancer survivor, having been first diagnosed with leukemia as a child. And Kirk lost both of his parents to the disease 6 months apart. Now, they're here to lend their support to VGH and UBC Hospital Foundation's Greater Than Cancer campaign. And that's a province-wide initiative to raise awareness and funds for cancer care in BC. And it's my pleasure to welcome Kirk and Genevieve here today. Thank you so much for joining us.
Thanks for having us.
It's really good to have you. Genevieve, why did you want to share your story?
I think to really give hope. I think the biggest thing for people is all we hear is cancer, all we hear about is VGH, all we hear about is the hard healthcare that we have. And I think it's really about people understanding that we have world-class surgeons and people right here in our own backyard, and making sure people understand that and see that their funds are going to helping us, because as we know somebody with cancer and it's not getting any slower.
Absolutely. And you know, we've just been talking about emergency room closures and the pressure on emergency rooms. So yeah, when people hear hope to do with healthcare, you know, how do you see hope?
Yeah, we were having this conversation this morning that, I have always felt at home and I've always felt taken care of. I was treated both at Children's and at VGH, so I've seen both sides of it. Yeah. But I think the biggest thing and the biggest message is knowing that we need to continually fund that so we get better care. And so these long-term effects aren't going to be the same as what they were before, because prognosis 15 years ago when I was first diagnosed, and the prognosis now has, almost increased 40% in a good way. And so, like I said, we always hear about really sad stories, and there's a lot of positive, like you said, and hope, and survivors like me.
And how are you doing?
I'm doing great.
Yeah.
44 now. And, when I was 15, I never thought of, graduating high school and getting married and, seeing nephews and nieces and seeing my parents grow old. And so to me, it's a great joy. And I think the biggest reason we want to share this is people really knowing where money goes, seeing it actually, in front of them, because a lot of people, just give $10, give $5 and never know if it actually does anything. So I think it's proof, and we are two survivors, just in different ways.
Yeah, I like how you look at Kirk when you're talking about that, what you were able to experience. And so, Kirk, you're someone, as a spouse, you've been through this as a son, and you lost both of your parents. I'm someone who lost a parent to cancer as well. And, what do you reflect on when you think about that experience?
Well, it wasn't a good experience.
Yeah.
I was going through retirement, it was my first year of retirement, and both parents were about a year away from being retired themselves. And then I was, 36 at the time, and they were young, 65, 67. Yeah. And then 6 months apart. It was pretty tough. I have an older sister who's 6 years older, and I can remember just looking at her after my dad passed away. He was second to go, and I said, we're orphans now, and it hit home. And of course, the cancer part of it, there had been no history of cancer in our family. They were the first two that took their lives, obviously, and we're dealing with some family members now that are battling cancers, and we all have friends or neighbors that have gone through it or are going through it now. And as Genevieve mentioned, whatever we can do to continue to raise money for these specialists, the doctors and the researchers, we have world class in each section, and the more money we raise, they can continue to bring in better things for lots of hope for these cancer patients and families.
What's it like for you to speak about cancer, kind of using your platform?
Well, exactly. I mean, it's after I met Genevieve and got her whole story, it really became a no-brainer. I do lots of charity work and other charities, which I love doing, but this one obviously hits home, and like you said, whatever I can do, to use my so-called celebrity status to bring awareness and to help raise funds for research and for the doctors, the least I can do.
And because of your experiences, have you been able to kind of keep an eye on what the progress is? What are the developments, and what have you seen?
I think that's one part, and the biggest thing about the money being raised is to expand that and make sure that we can discover earlier, we can figure out what's happening. Because when you're talking about BC as a whole, when somebody's in, Prince George, or they're in Terrace, or they're in Kitimat, they're not going to see specialists first. So the first thing that they do is they go to a GP, hopefully, or, if something's happened. When that happens, blood tests get then sent down to pathology, and it goes to VGH. Most people don't know that, and so they're able to actually understand what's happening quicker, because as we know, that time is the essence with a lot of these diseases. So figure it out. We can get them down to the world-class service that they deserve. We deserve that.
That it's that early diagnosis that makes a difference.
Yeah.
100%.
Yes, go ahead.
I totally agree, and I try to preach on the male side of it, for to get out there and get tested, or whatever it may be, whatever the cause, your prostate, your colon, whatever it may be. Do your duty and get tested, because early prevention definitely can save your life.
Genevieve, you sound very aware of the process. I mean, is it, how much of that process is part of your life? It informs your work.
Yeah, and for me, I think knowledge is power.
Yeah.
Within reason, because the first thing that we all do, it doesn't matter if we're going to a new restaurant or we're going diagnosed, or Kirk tells me something I don't know, I Google it, and I think it's the beauty of the internet, but it depends what you hit first, and the first thing you hit can be it's over, get your life in order, figure this all out. And I think that really touches on something, not just VGH, but I think VGH and UBC are trying to do is it's not just about cancer, but it's after cancer. Because I'm dealing with things that I'm 44. I never thought about having children when I was 15. It was just let's survive. Like you said, so now there's things that are starting to come up. So at least there's a place and a home and people that I can talk to that are going through different types of things. You know, now we're talking about hormones. Well, we weren't worried about that when I was 15. Now I'm 44. So the biggest thing is making sure that we can expand the care, get diagnosed, have survivors living longer, so then we can start to see kind of, let's say, the fruits of our labor.
Have you heard from anyone? Has anyone reached out to you since you've come forward with your story?
Oh, absolutely. On social media, Messenger. You know, I whoever's listening out there, I'm receiving your messages, and you know, you're in my thoughts, obviously. And there's some great feedback from the people that have told me their journey and their stories of what they've gone through.
Yeah, and what do you want to say then to people who reach out to you, to people who are going through this journey?
Well, I think just, you know, continue to believe, and there's lots of hope out there. Like we said, we're raising monies here for the researchers and the doctors to get better than what we are right now, which is very, very good, obviously top notch. And, you know, just, you know, keep the faith and keep plugging along.
Yeah, Genevieve?
Yeah, I think for me, it's understanding that we have world-class care here. We really do. And I think the first thing is we hear a lot about, you know, moving, or let's see what's happening in the States. Let's think what's happening overseas. What happens now is with diagnosis and with all the hospitals, they all work together. So when there's something that they find, they all share that. They all talk about things, and, you know, it's only going to get better. But we need to make sure that the care is what we have here. Those people get the care that they need. And then moving forward, you know, in 10 years, 20 years, they're going to be helping out the next generation.
It's really wonderful. It's laudable that you're sharing your story. I'm sure there's a difficulty in it, but I really want to thank you for your time and being here with us to talk about it.
Yeah, you're welcome. Thanks for having us.
I wish you all the best.
You too.
Kirk and Genevieve McLean. And again, they were speaking about cancer, and they're in support of the VGH and UBC Hospital Foundation's Greater Than Cancer campaign. That's it for our show today. Thanks so much to everyone for joining us here and joining us for our discussion. Our email again is bctoday@cbc.ca.